and Toronto's Medical Officer of Health, Dr. Eileen de Villa. Mayor Tory?
Well, good morning, and thank you, Brad. Team Toronto is continuing non-stop to help residents to get vaccinated, and more than 6.6 million COVID-19 vaccine doses have now been administered by our Team Toronto partners. More than 1.4 million third doses have been delivered, including more than 57,000 booster doses over the last 7 days. When it comes to major cities around the world and vaccinations, we continue to lead the way. I want to thank everyone who continues to step forward to get vaccinated. This continues to be the right thing to do, as it has been all along, because it gives you the best protection possible against COVID-19, and it will help us all to bring this pandemic to an end. Now, beyond the steady daily progress, one key to our success helping residents to get vaccinated has been our ability to work with as many partners as possible to build up major vaccination drives. Today, I'm thrilled to announce the Vax the East, a campaign which will kick off this weekend. Vax the East is Team Toronto's new 10-day vaccination campaign focused on residents in the East End of the city. Vax the East will bring vaccines closer to home for thousands of residents in Thorncliffe Park, Flemington Park, and across Scarborough from the 12th of February to the 21st. The campaign follows the success of last month's Vax the Northwest clinic, where nearly 1,700 people were vaccinated in a single day, and Scarborough Health Network's Family Roll Call Vax Weekend, when almost 5,000 doses of vaccine were administered. As well as the success of Toronto Vaccine Day and Kids Vaccine Day before that. These were also ventures that were very successful at focusing attention and getting people in given areas to concentrate on getting vaccinated, and for us to make those opportunities as accessible as we possibly could. New to this campaign, Vax the East will have multiple events, each focused on a specific community. Kicking off this weekend, 2 large-scale vaccination clinics will take place. Both clinics will run on Saturday and Sunday from 8 in the morning until 7:30 at night. One clinic will be held at the established vaccination clinic operating in the Thorncliffe Park Community Hub, where a wonderful job has been done throughout the pandemic vaccination period in getting people vaccinated. The other clinic is a one-weekend-only pop-up at the Ontario Science Centre. I want to thank the Ontario Science Centre for partnering with us in this clinic. We reached out with the request, and they responded with an enthusiastic yes and asked how they could help. Both locations are easily accessible by the TTC, have ample parking, and are well-established fixtures in the Thorncliffe and Flemington Park communities, respectively. The clinics will be fully accessible and will deliver unique, safe, and family-friendly vaccination opportunities for both children and adults. First and second doses will be available for anyone over the age of 5, and third doses for those 18 and older. And appointments can be booked now through the provincial booking system, which you can find, among other places, at toronto.ca. Walk-ins will also be accepted, and health cards will not be required. Like Vax the Northwest, for the Thorncliffe and Ontario Science Centre clinics, we have partnered with the TTC to have free shuttles running to and from these clinics from community hub locations all day. In partnership with Toronto Community Housing and community ambassadors, convenient community hub locations are being chosen, door knocking and outreach to local residents is taking place in advance, and the TTC will be running special free Vax the East shuttles to the clinics. And I want to thank the TTC for their continuing cooperation. It really has been marvelous. Anytime we go to them and ask for anything to be made available to us, including these shuttle buses, they respond as well with an enthusiastic yes, and how much more can we help. While our outreach efforts are focused on Thorncliffe Park and Flemington Park to reach these neighbourhoods with lower vaccination rates, the clinics are open to everyone. Following the 2 weekend clinics, Vax the East, Scarborough will roll out more mobile vaccination clinics in schools across Scarborough next week. From Valentine's Day to Family Day, mobile teams will visit up to 6 Scarborough schools every day, with vaccines available for eligible students, staff, parents, and the wider community. Team Toronto has been working hard to make vaccine access more equitable across this, and part of this is breaking down language barriers. Vaccine information and Vax the East clinic details are available in multiple languages, and that is something that hopefully will increase the access and increase the information available to people. Vax the East wouldn't be possible without the hard work and collaboration of a whole bunch of partners, and I want to name them because I think it's very important for us to acknowledge who is helping us to have this outreach and to make the access to vaccines more equitable and to make sure we penetrate those communities where we've had a bit more of a challenge getting people vaccinated. The city itself, through Toronto Public Health and also the city's own departments, the Michael Garron Hospital, the East Toronto Health Partners, the Scarborough Health Network, and the Scarborough Ontario Health Team partners. And then we go on to have great assistance from the Ontario Science Centre, Toronto Community Housing, the Toronto District School Board, the Toronto Catholic District School Board, the TTC, and other Team Toronto partners. As with past hyperlocal clinics, our vaccine engagement teams and our on-the-ground ambassadors will be reaching out through their community networks to spread awareness and help book appointments for these clinics. We are absolutely committed. It remains an absolutely steadfast, determined commitment on our part to help all residents in absolutely every single part of our city get vaccinated. And we will make more intense efforts where that more intense effort is required, as we have been doing throughout. This is an all-hands-on-deck effort, and it has been exactly that way throughout the pandemic because your vaccination status should not depend on your postal code. We have put into place absolutely unprecedented outreach efforts and planned events like Vax the East to make sure that people in areas with lower vaccination rates get the information, get the access, get the assurance, get the familiar faces in front of them that they need in order to get themselves vaccinated. That made a difference when it came to first and second doses, and it's making a difference now when it comes to third doses and to getting kids vaccinated. Between January 10th and January 31st, we have seen third dose vaccination rates increase significantly above the city average for residents 50+ in key neighbourhoods. In Mount Olive, for example, third dose rates went from 37 to 50%, an increase of 13% during that relatively short period. Black Creek, the rate of vaccination for third doses went from 40% to 56%, an increase of 16%. Caledonia Fairbank, from 42% to 56%, again an increase of 14%. Weston Pelham Park, 42% to 57%, an increase of 15%. Keelsdale, Eglinton West, 42% to 56%, an increase of 14%. And when it comes to school-based clinics, we have partnered with the TDSB and the TCDSB to ensure that all parents were called, they were emailed, and they were texted in advance to help increase vaccination rates. That all is working, and it is, as you can see from the numbers, it is making a difference. And of course, those numbers are people who, after getting, whether it's a first, a second, or a third dose, or kids' vaccinations, are then better protected, equally protected to some of their fellow citizens who had those vaccinations earlier. I'll give you another example. In Elms, Old, Rexdale, Malvern, and Scarborough Village, 3 neighbourhoods where we focused over the last 2 weeks in January, we saw kids' vaccine rates increase by more than 5% compared to 2% citywide. So when we make that intensive effort, which we are doing and will continue to do, it makes a difference. Our VaxTO campaign is sending out automated call to residents tomorrow about the TO Vax the East campaign. This is local, targeted, effective effort to help people get vaccinated. And yes, in many cases it literally involves knocking on individual doors one by one, floor by floor, building by building to convince people to go. Just this past weekend, together with Councillor Joe Cressy, I visited a Toronto Community Housing vaccination clinic in Deputy Mayor Bylow's ward, and she was there as well. And we saw this in action. We saw people there that had sheets that indicated each of the names of each of the people in each of the apartments, and they went and knocked on each of the doors, and they could record, had the person already been vaccinated, were they hesitant but needed just more information and assurance, were they people who refused? But we had that information, we were able to work with those people, and I saw the people coming down the elevator to get vaccinated, and they were doing it in the company of people they knew from the local community health organizations and from the neighborhoods. It was proof positive that this system is working. The hyper-local approach by the Toronto Community Housing Corporation has, for example, seen more than 500 clinics developed successfully and delivered in Toronto community housing buildings and communities since 2021 April, with another 109 clinics planned in TCHC buildings in the coming weeks. All of these efforts will ensure that everyone in every part of our city, without exception, gets vaccinated. This is something that I personally feel very strongly about. It is something I've worked very closely with Dr. de Villa and Councillor Cressy on throughout this campaign, and she will tell you that I asked, probably to the point of being a nuisance, about the neighbourhood-by-neighbourhood data so that I can see that we are making the kind of progress that I've outlined to you this morning, because it is important that we not comfort ourselves with the citywide averages, which are excellent in the context of any other global diverse city. But at the same time, those overall numbers mask some disparities that exist, which we are determined as a team to overcome and to address. We are putting our efforts where it is needed for us to ramp up our efforts and to provide that extra degree of assurance or contact or accessibility to make sure that people can get vaccinated. And Team Toronto has been indispensable to us in making sure we can actually carry that out. We have made steady progress. We have made steady progress in areas where it's been a little more challenging to do so, and we will continue to apply our efforts to those areas in particular to make sure that no one is left behind. I want to thank everyone for their involvement and their commitment to helping residents get vaccinated. You will hear from Dr. de Villa this morning that it is making a difference on the health front itself. It isn't just about the numbers. It's about real impacts on the health situation here. These vaccines continue to be our best shot at limiting this virus and at getting us back to a situation where we can return to a more normal life. So I continue to encourage people to come themselves and with their children, their co-workers, their friends, their family who haven't yet been fully vaccinated, and attend the Vax the Eats events. And as I mentioned, those include walk-ins and they include people from across the city. We're focusing our efforts in a geographical area, but again, it's open to everybody. And on that note, I would like to ask Dr. de Villa to deliver her remarks for today.
Thank you, Mayor Tory, and good morning. Over the past week, we have seen more evidence that the Omicron wave is subsiding in Toronto. Over the weekend, Toronto averaged 417 daily cases, which is down from 686 the weekend before. The percent positivity of COVID-19 tests has also decreased week over week from 16.6% to 12.3% as of the end of last week. Other indicators confirm this trend too. The number of active outbreaks continues to decline in settings all across the city, and levels of COVID-19 as measured in Toronto's wastewater continue to hold across the city. While the spread of Omicron may be waning, there is still significant risk to those who are unvaccinated or those who are under-vaccinated. Thanks to the data we've collected in recent weeks, we now have a clearer picture of how Omicron is affecting Torontonians and further confirmation that the COVID-19 vaccines continue to offer strong protection against severe outcomes from this variant. Breakthrough infections, or infections after vaccination, continue to be relatively rare. The most current report shows that only about 2.4% of individuals in Toronto who had at least 2 doses of COVID-19 vaccine became infected with COVID-19. And this most recent report shows that there is even greater protection provided with 3 doses of COVID-19 vaccine on board. Torontonians with 3 doses had the lowest rates of hospitalization, ICU admission, and death compared to any other level of vaccination. In fact, the older and more under-vaccinated an individual is, the more likely they are to require hospitalization. According to the most recent data on Toronto residents, unvaccinated individuals 60 years of age or older are at a risk at least 6 times higher of hospitalization from COVID-19 infection compared to those who had 3 doses of vaccine. Unvaccinated Toronto residents also had at least a 14 times higher risk of ICU admission from COVID-19 illness compared to those with 3 doses. Team Toronto continues to make every effort, as you've just heard the Mayor say, to increase uptake of the COVID-19 vaccine through an accelerated, data-driven strategy to create vaccination opportunities across the city, especially in neighborhoods and communities that have been disproportionately impacted by COVID-19. I remain ever grateful for the efforts of Toronto Public Health staff and our Team Toronto partners. From events like Vax the East that Mayor Tory just described, to community-based efforts including pop-up clinics in congregate settings, schools, shopping malls, and transit stations. Together, we continue to ensure vaccine is accessible where people live, work, study, and play. In so doing, together, we will keep our households safe, keep our communities safe, and ultimately help bring the pandemic to an end. I'll now turn it over to Brad to moderate the questions.
Thank you, Dr. de Villa. We'll go first to Francine Copin from the Toronto Star. Francine, go ahead, please.
Yes, good morning. My question is for Mayor Tory. Mayor Tory, I'm wondering if you could respond to the Provincial Housing Task Force recommendations that were released yesterday.
Well, thank you for the question, Francine. I'm just glad we're having the discussion and that they've looked at it on a province-wide basis. I'll take something like garden suites, for example, which we dealt with at City Council last week. The discussion here at City Hall that led to us now permitting these garden suites to happen in neighborhoods as appropriate across the city started with a provincial requirement that every city in the province had to have such a provision to allow for those kinds of suites that will increase the supply of housing, and do it in a careful and considered way, but do it nonetheless. And so there are some ideas in this report, some of which will be more controversial than others, but I'm glad we're finally having the discussion, because the problem with the supply of housing, including affordable housing, will not be solved by more and more high-rise buildings alone. They are part of the increased density, especially around transit, is part of the answer, but there has to be a citywide answer where there is gentle densification and gentle increase in the supply of housing taking place across the city. And I'm very determined to see that it happens in a proper and a disciplined and considerate manner, but that it happens nonetheless. We simply will not be able to sustain the growth in an equitable and fair manner and make sure everybody can find the City of Toronto to be a home for them unless we undertake that kind of an effort. So in that sense, I think that while there are some recommendations in the report that are more controversial than others, the general menu that it lays out of things that we could do to enhance the supply of housing, including affordable housing, is something that I think will begin a very much needed discussion.
What about the recommendations that seem to require municipal cooperation, and well, most of them do, especially the one putting an end to exclusionary zoning that shuts multifamily housing out of single-family residential neighborhoods in about 70% of Toronto, as was reported today by Tess Kalinowski in the Star. I mean, is that going to be controversial, do you think, here in Toronto? Is there going to be a lot of opposition to that?
I mean, it is a fact of life that everything we have undertaken so far, laneway housing, people forget that there was some controversy associated with that. We've seen the controversy that exists with respect to multi-unit housing, sometimes known as rooming houses. We've seen that even with garden suites, which I consider to be something that is, carefully handled as we will as a city, is something that can only be a plus for many, many families and many, many people who will see an increase in the supply of housing, sometimes for tenants, but sometimes for aging parents, for example. All of these have with them, as have the supportive housing developments that I've gone right across the city over the last 12 or 14 months, supporting every one. Because we are past the point as a city where we can leave people, for example, who are homeless, and where the answer rests in building supportive housing for them and having the supports there to address some of the special needs they have, and just assume that it's always going to be built somewhere else. We need it in the city. We need it now. And I've been going across the city making that point. And you know what? While it starts out sometimes controversial, when people hear that message, when they hear how carefully we're doing it, when they hear the supports that are in place, they become, in the main, very supportive. And the same is going to be true, I think, if we do careful, gentle densification in different areas of the city, that we will be able to persuade people that this is something that is going to be in the best interest of maintaining stable neighborhoods, of making sure that we can look our own kids and others in the eye and say, yes, there is a place for you in Toronto, and that we can do it without in any way. Stable neighborhoods don't necessarily have to mean static neighborhoods. They can still be stable while not being static. I'm often struck by the irony of the fact that a lot of the great big houses that you see that are now owned by one family used to be in some of those very same neighborhoods, houses in which there were 2 or 3 flats. That's how they were put together initially. And we're simply looking at the possibility of returning some of those to a state they were in 50, 100 years ago. And so this is something that I feel obviously very seriously about, and I don't know that this report has all the right answers in it. There are some that, that are a bit out there, but I do think that municipalities and neighborhoods and people, individual people, have to decide, are we really going to be together, unified, as we've been, for example, on vaccinations, in addressing the supply of housing, including affordable housing in this city? Are we going to be as one in saying that there is going to be a place for everybody here, including our very own children? Are we going to be serious about that? Because that requires a citywide response.
All right, thank you. We'll go next to Lorenda Redicott from CBC News. Lorenda, go ahead. Sorry, Lorenda, we just have to unmute you. We're just give us 1 second here, folks. Stand by, please. We're just sorting out our...
Hi there, Mayor Tory. Sorry, I'm having some connection issues here.
Go ahead, Lorenda.
I hope you can hear me. Sure.
Go ahead, Lorenda. We can hear you.
Also a question on housing, Mayor Tory. The provincial task force, they're calling for some pretty sweeping changes to how the housing developments get approved. How concerned are you that the province would be taking away too much power from cities to shape what that housing looks like?
I've had extensive discussions with Minister Clark, with Premier Ford about this, and I have emphasized to them that it is local officials, local elected representatives and local public servants who know best how to see developed and see progress and see, engage in some process of change the neighborhoods for which they're responsible, not the provincial government. So what the provincial government, I believe, can do is to facilitate the cities continuing to do what they do, but perhaps doing it in a more effective, efficient manner. There are ways in which we found even at the city that we can improve our approval processes so that we don't take any less care, but that we just get things done faster. A lot of that is a simple matter of making sure that instead of getting 10 people separately to comment on something, you have them all together at once and get them to comment, and that you don't let files sit on people's desks for 6 months, because they're busy with something else. And so I believe very strongly, especially when it comes to planning larger urban areas, that the responsibility should rest with the locally elected officials and with the local officials who work in that government, because they know best what is best for their community. But the province can help us with a kind of an overarching framework that makes it possible for us to more effectively and efficiently carry out that responsibility, but for us to carry it out. And that is a very strong belief that I have, because, that's why we have a city government. Yes, it's to provide services to people, but it's also to plan our community in a way that is consistent with the wishes of the residents of our community here in the City of Toronto within, the parameters of provincial legislation.
And follow up, another issue that comes up in that housing report is public consultation, and that there's a need to limit the time consulting the public. Some have raised issues with the way public consultations happen. What do you think? Are there changes that are needed to public consultations?
I think that if you really look at it in terms of the time that is taken, because the fundamental issue that the report and other discussions in this regard is trying to address is the length of time it takes between somebody, say, buying a piece of land and then going through all the way to the day when somebody can move into the housing that's on that land. And I don't think the problem here is with public consultation. If you look at it, I mean, the number of meetings that are held, the time they take, which is measured in hours as opposed to days or weeks or months, is not that extensive. I think that there are greater improvements we can make on the process of going with the public consultation results and implementing those and moving forward on all of that. And I think that technology has proven to us during the pandemic that we can use virtual consultation to a greater extent, so that if you have to have a second and third round of meetings, it won't necessarily have to take the time that is somehow and sometimes taken to have public meetings in rooms. Those are desirable and certainly get people together, which is a positive thing, but I think we can use technology now to engage in much more of that kind of consultation than we did before, so that I don't think the problem is an excess of consultation. The problem is taking the results of the consultation and implementing those results in as quick a manner as possible, while still being careful and shortening the overall time period from the day somebody comes into the City Hall wanting to build something and the day somebody actually moves into that housing.
We have one final reporter on the line. It's Trevor Dunn from CBC. Trevor, go ahead, please.
Thanks, Brad. This question is for Dr. de Villa. Dr. de Villa, this is about sports in schools in Ontario. Right now, indoor sports that are deemed high intensity or contact, such as basketball, aren't allowed to be happening at the school level. However, many people pointed out that outside of schools, sports such as minor hockey, which is indoors and high contact, can go ahead. Do you see a sort of disconnect between, this difference supposedly between school sports and non-school sports? And is this something that you can change at the local level to allow indoor school sports in Toronto to go ahead?
So my understanding, Trevor, is that this is a discussion that is actually happening all around the province in respect of, how best do we proceed? How do we make sure that those environments within our school settings are as safe and optimal as they might be, given that we are still in the midst of a pandemic? Overall, as I look at this, certainly in Toronto, I can't speak as well for the rest of the province, but when we look at our circumstances here in Toronto, we have reason for cautious optimism. As I explained earlier today, we are seeing trends with respect to Omicron activity moving in the right direction. We're seeing some waning activity, so I think that certainly bodes well in our favor. And from our perspective, what we're doing here on the ground, which is within our control as local public health, is working with our partners to ensure that we're doing everything we can to support as safe a school environment as is possible at this point in time. And a huge chunk of that has to do with providing vaccination opportunities, particularly within school settings, making sure that members of school communities are as vaccinated as they can be, and taking up opportunities to get that protective benefit of vaccination in their school as much as possible. Looking at our own activity here, 90 clinics within schools within the last 2 weeks of January, and I think just under 60 last week and this week alone. So this is the kind of thing we can do to help support as safe a school environment as is possible while conversations are ongoing.
And just to follow up, I think we all kind of feel that cautious optimism. Of course, we're looking at a finite sort of timeline here with the school year wrapping up, and some students who play sports such as basketball or volleyball in high school, they might be in grade 12 and this is it for them. So there's not a lot of time here. Is this something, do you think there's enough of this cautious optimism that we could see school sports in Toronto before the end of the year?
Well, Trevor, I think you ask an important question, and certainly I think that there's hope, and we really are doing everything we can locally to support that optimal school environment. And to my mind, that's why we do have to focus on the things that we can do locally as the local public health department. So certainly the more we are able to continue those efforts, the more we're able to get that protective benefit, I should say, of vaccine available and taken up. As we've seen great success thus far in the city, I think Torontonians have shown that willingness. We have over 90% of our population with at least one dose on board. I'm hopeful. And certainly as the weather improves, it gives us the opportunities to take better advantage of the outdoor space and to use ventilation opportunities, things as simple as opening windows. I think there's lots of hope and opportunity as we move forward in the next few weeks.
Thank you, Dr. de Villa. Thank you all for joining us. That concludes today's briefing. Please stay well.